Assalamualaikum dear doctors. In this video I am discussing about Guillain-Barré syndrome. So Guillain-Barré syndrome, shortly GBS, is an autoimmune disorder often considered a post-infectious polyneuropathy involving mainly the motor but also sensory and sometimes autonomic nerves. Now the etiology of Guillain-Barré syndrome is that Campylobacter jejuni, cytomegalovirus, Mycoplasma pneumoniae, Epstein-Barr virus, vaccines are rabies and avian flu influenza. Clinical features. What happened in Guillain-Barré syndrome? That is a post-infectious polyneuropathy. And the clinical features is weakness. That is Landry ascending paralysis, pain, ataxia, paresthesias, shortness of breath, areflexia, dysphagia, autonomic involvement and absent or depressed the deep tendon reflexes. Miller-Fisher syndrome, what we find, that is external ophthalmoplegia, ataxia and areflexia. Now about the pathogenesis of Guillain-Barré syndrome is that number 1, immunoresponse to preceding infections. Number 2, cross-reacts with the peripheral nerve components due to the molecular mimicry. And number 3 is resulting in demyelinations. Diagnosis of Guillain-Barré syndrome is clinical. Lumbar puncture, that is albuminous-cytological dissociations, elevated protein with normal or mild pleocytosis and serum creatine kinase. Management including intravenous immunoglobulin, IVIG, and plasmapheresis, steroids and or immunosuppressive drugs. Combined administration of immunoglobulin and interferon is effective in some patients. So this is all about Guillain-Barré syndrome.